Today I have a really amazing guest speaker. She is a nurse at Life Care Center, and she is the infectious disease nurse. And I'm not sure if anyone knows that there's a special specialty in different healthcare organization, whether it's a hospital or rehab or clinics. But for the most part, there is a specific specialty that focuses on what else? Infectious disease, right? Very important. So her name is Mary Jo McCluskey, and I'm so thrilled and honored to share her knowledge with you today. So welcome, Mary Jo.
Thank you so much. It's really an honor for me to be invited onto your program. Really excited.
I know you're going to be covering a lot of basics, which is so important because it's all about basic skills that we could do, right? And I'm sure you'll reiterate that throughout the whole program. So I'm going to put on the presentation, but before I do that, I want to ask you what got you into nursing and also specifically focusing in on infectious disease.
It's kind of my life's path, if you will. When I got out of when I was out of high school, I graduated, and then I went to school and I studied at a school that had both biology and foreign languages. And I really wasn't sure what I would end up in. I ended up in biology. I absolutely loved it and graduated with a degree in medical technology. And today, I think they call it lab science. So if you go to your doctor and you have your labs drawn or you need some kind of lab results, and I would be the technician that would analyze that and provide the results. I loved it. It was a number of years ago. And during my internship, I stuck myself with a needle, and it not once, but twice. And that was very disturbing because it was in the era of HIV/AIDS, and they weren't even sure why people were dying of this illness and what illness it was that they were dying of, but they knew the exposure was with blood. So basically, I graduated from college and worked in other areas than the clinical area, if you will. I had a fantastic career. I was making lots of money. I was learning lots of things and doing a lot of different creative things with my degree, and I loved it. But during this time frame, I became a big sister with the Big Brother, Big Sister program. And the director of the program was a sweetheart. Everybody loved her. And then one day 9/11 hit. And, there were a lot of airplanes, a lot of people from Boston, New England were affected. And over time, I had realized that it was the director of that Big Brother, Big Sister program that I knew very well was murdered on the first airplane, Debbie. It was really awful. She had relocated to California to be with her son and his family and was out here in June, July, and August visiting with her girlfriends and her family and was traveling home. And that's what happened on 9/11. So then that was a real, kicker for me. And I really did a nice introspection, if you will. And I really had to reevaluate, what was I doing? Where am I going? And at the time, my husband had said, well, what do you want to do? And I said, I've always wanted to be a nurse. And he said, what are you waiting for? So, that sparked my career as well as, other personal experiences with my parents, with my grandparents and other people that I knew taking care of and that sort of thing. But, at the end of the day, you have to do something that really, sparks your soul. And is meaningful. And then, so nursing, I've done a lot of different things with my nursing career. And here I am doing infection prevention for the last 10 years. It's interesting that I started off in medical technology. So it kind of puts everything full circle, if you will. And here I am. And I do love it. And it's such a great opportunity for teaching, but also for learning, changing all the time. As you know, things change and environments change. But, what we're doing today is we're going to start right at the basics. And what's the first thing we think about? We just build from that. And I think that's where people start.
Thank you. And so I'm going to put on the presentation.
Yep, infection prevention. We're getting right back to the basics. And I do work at Life Care Center, West Bridgewater, Massachusetts. And here we are back to the basics. And here's Mona Lisa. I mean, how many times have we been in the store and people are coughing and my head explodes and I'm like, can you just cover your mouth? Infection prevention, it just starts with the basics, So that's what we're doing today. So I did want to talk about the nature of an infection, how it comes about and why these things happen. Infections are diseases and they're caused by pathogens. Now, pathogen is a microorganism that causes infections in humans, also known as a microbe. So that's really where it starts. We need a pathogen, and once that pathogen, gets into our body somehow, it can cause an infection. These microbes are pretty interesting. And for a whole infection to take place, there were three things that really, really need to be in place first. Three factors, if you will. We need a source. Where is the source of these microbes, these microorganisms? How do these microorganisms transmit, or how do they travel? How do they get from one place to another? And then they need a host, a susceptible host that they can launch into, if you will, or take hold of, and then the full-blown disease, if you will, or infection can take place.
Can you clarify even more? You clarified the pathogen. You said it's a microorganism. People might be thinking, is that a bacteria? Is that a fungus? What is that?
Listen, the pathogen could be a virus. It could be a bacteria. It could be something that's foreign to your body. It could be even an insect. Or, something like that, but it doesn't necessarily. But yeah, there are a lot of different things that could be pathogens that could get into our bodies and initiate and cause infection. Mm-hmm. So it could be viral, it could be bacterial, could be, parasite. There are a lot of different nasty pathogens out there that do cause disease. So the nature of an infection. And if you hit enter, we need a source. Where is this pathogen? Where is it stored, if you will? Where does it live? And then enter again. And how does this transmit? How does it travel from one area to the next? And then again. And it needs a host, a susceptible host, a vulnerable host that can, therefore the microbe can, how do I want to say it, can expand to its full potential, if you will, and full disease. And so as long as we have those three things, a source, a method of transmission, and a host, that infection just continues. It continues and continues. So I do have a pop quiz, and my pop quiz is, how do you stop an infection? So if you hit enter, You
Oh,
stop an infection by stopping the way this pathogen travels, the way that it moves, and the way it transmits from
mhm.
one area to the next. So if we can just stop that transmission, then we're stopping that microbe from getting to the next host and causing an infection. So
Mm.
the chain of infection, if you will, is broken by stopping the method of transmission. So if you hit enter again, we're going to break an infection. We're going to stop an infection by stopping the method of transmission. So, what could be the number one way of stopping a method of transmission?
Uh, well, you need to do some prevention work. Like, say, if you're in a high risk mosquito area, you would probably spray yourself with some mosquito repellent, or maybe not be around, not be outdoors during the peak of the times. Um,
I love that.
yeah, uh,
Yeah,
yeah,
that's one method.
that's one.
Just any intervention you can think of that would help to keep yourself safe.
Mhm.
Um, yeah,
Yes,
I love it.
and then another way would be to uh, to stop the method of transmission. So, say you already got infected, perhaps. So, keeping yourself from spreading it, what would be a good way? Would
To
be,
someone else.
yeah,
Yep.
taking care of
Yes. That's
yourself.
stopping the method of transmission.
Yeah, keeping yourself healthy, washing your hands. Yeah, yeah,
Yeah. Washing hands is number one,
yeah.
gotta say.
Yeah. Yeah, that's actually like that was key during COVID, wasn't it?
Oh, absolutely. Oh, absolutely. And I think just the general fear of what was going on and what was happening. I mean, oh, I hope we don't see that again. It was really horrible. It was sad. It was terrifying, and yeah, I'm glad those days are behind us.
Yeah.
But the hand hygiene was key. And also the other interventions that were put into place for stopping the method of transmission. We were wearing masks. In the clinical area, we were wearing gowns. We were wearing face shields, things
Mhm.
of that nature. And all these things, keeping us safe to
Yeah.
prevent the spread of transmission, and washing our hands. We were washing our hands constantly, constantly. Even now, I train people and I advocate for them, gel your hands, and, there's alcohol right at the front of the doors of every single room. And I say gel in and gel out,
Mm-hmm.
just as much prevention as possible. In January, February, and March, we experienced a very large norovirus outbreak.
Mm-hmm.
And norovirus, you break that with hand hygiene. And I think people just got, lax with the hand hygiene. But it's primary. Even when we're home, think about when you were a little kid and your mother would call you for supper. What is she saying? She's saying, supper's ready, go wash your hands. It's the simplest thing, and it is the most basic and most important method of really stopping the transmission of infections.
We're looking at we have the slide here that has the nature of infection. So if we use the example of the norovirus. So somebody has contracted the norovirus. So a good way for that particular person to prevent going into number two, which is being the carrier, right? They can what? They've
They
been
need to
already. They need to what?
they
What?
need to basically isolate.
Yeah.
Norovirus is incredibly contagious. It's incredibly contagious. So someone who has an active case of norovirus, you need to stay home. You need to stay home. And you're probably going to want to because the symptoms are highly uncomfortable, if you will. You have that, uncontrollable diarrhea. And how do you, go out and go to an event if you can't control that? You can't. And I think someone with an active norovirus is just going to stay home anyway. Visitors, they can still have visitors, but the visitors need to understand that they themselves need to be washing their hands extra vigilantly. And, the environment, we want to, clean, the things that we touch, our high touch surfaces, and what could that be? Well, that's the toilet handle, and it's the electrical light switch. It's going to be the phone. How about it's going to be the handle on your refrigerator or the handles to your cabinets. These are the high touch areas where if we're not cleaning them, that could be a method of transmission. So especially with any highly contagious disease. Another one would be conjunctivitis. That's a good one from dirty hands. And of course, any mom will tell you, they could almost start crying when one of the kids comes home with the conjunctivitis. Well, that means, all the bedding's got to be washed. The linens have to be washed. It is that contagious. And the root cause is dirty hands, So it's a big thing. I think, this is basic, and I think we know it, but then to, verbalize it and be, remind ourselves, just, reminder, I feel as though that's what we're doing here in this program. It's just vital.
Let's say somebody has a norovirus and you said the high touch area, the toilet, the flush. Maybe we could add also the sink.
Absolutely.
Faucet,
Absolutely. The faucets, everything. Yeah. Yeah.
And so, if a person says, okay, I'm going to disinfect, is a simple, one of those spray disinfectant spray, is that sufficient? Or do they need to use some sort of a bleach type product to really, wipe that area and let it dry? What are effective ways to kind of cut back on that infection?
That's really great. I think if I personally were dealing with a norovirus or that sort of thing, I'd want to go right to the bleach. There are some microbes that are killed with alcohol. However, the norovirus is not one of them. If anyone's had the misfortune of maybe a Clostridium difficile, or they call it C. diff. No, that's another one. You want bleach. Yeah, I love bleach. But you want to read those labels on the disinfecting that you're using, and some of them, aren't good for something like a norovirus.
I'm really glad you talked about norovirus and how the alcohol sanitizer, the gels, is not effective on that, because I don't want people to, assume because of COVID, a lot of people are walking around with, the sanitizing alcohol spray. I'm one of them. But I think it's very important for us to really, hammer in that alcohol spray or gel, whatever you're using, is not going to be effective with all of the pathogens that you talked about. There's some that really requires us to wash our hands and and one of them is the norovirus.
What's the number one way of stopping? It's washing our hands. So even in a healthcare setting, if you will, when I'm teaching staff about, taking care of people and that sort of thing, hand gel is fine, but after 3 times, and that may even be a Joint Commission requirement, no more than 3 times, you got to go to soap and water. The number one, the standard is soap and water. Soap and water, and actually friction. It's the friction. So you have the soap and you think, okay, well, it's an alkaline or something, so that'll kill the microbe. It's actually a dual effect. It's the alkalinity of the soap, and it's the friction of scrubbing your hands, and in between the webs and your fingernails, and you're going up to your wrists. And so we say for 20 seconds and we say happy birthday. And I'm like, I'm done with birthdays. Just, pick another song. Just one method, that's probably 20 seconds. But I mean, by all means, if there's another song, you go right ahead and you sing it. I'm for whatever works.
Exactly. I'm so glad that you're mentioning the importance of hand hygiene, right? And really to use soap and water as much as you can. And I'm not sure if too many people know the three, using the gel up to 3 times, and after that going to the sink and using soap and water. I'm glad you said that too. It's very, very, very important.
Yeah, I don't think the general public really thinks like that, but being in a healthcare environment like you and I are, but that being said, I gave a lot of thought to the people in our audience, if you will, Debbie, and there are going to be some times when maybe they end up, with a decline, or something happened and they themselves end up in a healthcare, environment. And, so they need to understand, or maybe be a little bit familiar, what healthcare people are doing. But, I also feel as though as healthcare providers, we live this dual life. We're doing things at home that we're not necessarily doing at work. And we're doing things at work that we're not necessarily doing at home. And then I ended up at Life Care Center of West Bridgewater. And I love it. I love it. And so when I'm teaching the staff, I tell them, you're not coming to a place of work. You're coming to someone's home. You're coming to someone's home. And that's how I try to teach. I try to teach intentional, and I try to teach that, so that we'll all be aware. We have some residents here that live here. They're not safe to live at home in the community, so they live here. And then we have a fair amount of population that are here for rehab. They've been in the hospital. Well, they need to get a little bit stronger before they go home, and but they can live independently at home. But in terms of the staff, I just think that this is how we need to live one life. And we can't have these dual lives. And I try to explain it in ways that everybody will understand, because, I could do a presentation, and I don't think people would turn it off because, they don't understand what I'm saying. But I want people to watch, and I want people to understand and then implement these things in their life. And they're pretty basic and simple, and keeping safe.
Thank you.
When I think about the audience that's watching today, I like to hope that they are home. And so maybe this is a good time to think about or to learn what could happen if you go to the hospital. And so I kind of want to talk about that a little bit, and why it's important. All right. So we talked about microbes, and we talked about how they're microorganisms and they're pathogens that cause disease in people. And we talked about these microbes and how they travel, and they travel differently. And that's called transmission, how they go from like one person to the next, if you will. And they do this differently because they're really clever. And precautions in a healthcare environment are based on how these pathogens travel, how these pathogens are transmitted. The precautions in the hospital or a rehab center or a skilled nursing center, they're designed to prevent the spread of infections, and they're identified by how the pathogen, how the microbe travels. So, how do these things travel? Well, they can travel by contact, touch. They can travel by the air when someone sneezes. Remember Mona Lisa? Yeah, cover your face, all right? They travel by common vehicle, and like, really? At 55 miles an hour? No, that's actually spoiled food, which is an interesting word for it. And also by a vector. And a vector is by something that bites. So touching, sneezing, spoiled food, and by something that bites. So when we break it down that way, let's keep it simple. And let's try and we're gonna talk about each one of these precautions, and maybe put everything together, and maybe there'll be an aha moment for someone. So the first one is by contact precaution, and that means touch. So by this CDC photograph here or signage, look at all these microbes that could potentially be on your hands. And this is why we wash our hands frequently. So the print is very small, but we've got C. diff, we've got norovirus, we've got salmonella, we've got some Haemophilus, we've got E. coli. There are some pretty nasty microbes on that hand. And so contact precautions for someone who's been diagnosed with norovirus or conjunctivitis or Clostridium difficile, also known as C. diff. So you're going to be prepared. You're going to wear a gown. Either you're going to wear a gown, or if you've been diagnosed with one of these things, your visitors coming into the room will be wearing a gown, gloves, maybe a mask. So I want people to understand, why this is happening. These precautions are put into place not as a punishment. You've had something happen to you, you're in the hospital, you're already in punishment enough because you're not home in your own bed. You have to be in this hospital for whatever reason. And then all of a sudden, these people coming at you, with gowns and gloves, it's so undignified. But the reality of it, people are trying to keep you safe and trying to keep the public safe. And so how do we do this in the short term? That's how it contacts. So it's going to be norovirus. And your interventions here are absolutely hand hygiene. You're going to wear a gown, maybe a mask, maybe a shield, but wash your hands. These microbes that are on your hands, it's either E. coli or Haemophilus are the two biggest pathogens that cause conjunctivitis. But if you just think of where conjunctivitis is, oh my God, it's my dirty hands. It's my dirty hands. I've got dirty hands. My eye was itchy. I touched it, and you go to sleep, and then you wake up, and boom. Yeah. Wash your hands. Wash your hands before you go to bed. When you wake up, just wash your hands. So a contact precaution, if you're in the hospital, will be that people come, they'll wear a gown, they're going to wear gloves, maybe a mask, and you're going to see a lot of hand washing.
And people will typically be in their own room, correct?
Yes. They typically will be in their own room. If there's a situation where there are two patients, if you will, with a similar diagnosis, then they may be in the room together. That would be called cohorting. They would put you in another room. So if someone says, well, you're on contact precautions, and then you have a roommate, 9 out of 10 times you're going to, because it's something similar that you both have. We're not going to put someone with 2 different types of precautions in the same room. So if that ever happens to you and you're in with a room with someone else, it's because they also have a contact precaution. Yeah.
Thank you for clarifying that. Next slide.
Now, this picture from the CDC is absolutely disgusting. However, this is exactly what happens when we're in the supermarket and we're not covering our mouth. Those droplets can travel up to 6 feet. Actually, and then during COVID, didn't they say, Debbie, it was up to like 10 feet or something like that? Oh my God, it was so disgusting. Yeah, so please, like Mona Lisa, please cover your mouth because we don't want to get everybody sick. So here's the thing, droplet precautions, a droplet. So these are moisture particles that travel in the air when we cough, sneeze, even talk. We can spray saliva. That's basically the thing. So if you're in the hospital and you're on droplet precaution, you're going to see people coming into the room to visit you wearing a gown, gloves, and a face shield, protecting their mucous membranes, because you either have the flu, you have RSV, which is respiratory syncytial virus. Kind of new language out there, but it is a respiratory illness. Maybe mumps or rubella, pertussis, which is whooping cough, or meningitis. If you have been diagnosed with one of those illnesses, then chances are the healthcare providers will place you on what they call droplet precautions. When it comes to droplet precautions, think of mucous membranes. So when these droplets fall into your mucous membranes, your eyes, your nose, your mouth, even your ears. So someone once told me I have seven holes in my head. All right, so if these droplets attack or latch on to one of these holes in my head, I'm going to get sick with whatever they have, the flu or mumps. So you're going to see people coming in the room with a face shield. You're going to see gowns and you're going to see gloves. And that's because they need to protect.
Even more important for healthcare providers to, because they could be a source of transmission if they don't take the proper precaution when taking care of patients who are on precaution.
Absolutely. Yeah. Absolutely. And if they're not, then shame on them, because not only they're getting sick, they're taking care of other people, they're passing it to other people, they're going home, and now their families are sick. It's all about stop. And so this is what these precautions are about. The precaution is to stop the method of transmission. There are going to be times when the staff, themselves, are not feeling well. So maybe someone doesn't have norovirus. So someone, the patient doesn't have the flu or something like that. But then all of a sudden the staff is coming in with all this equipment. That's because they're trying to protect you. Mm-hmm. So that's called a reverse protection. Mm-hmm. So there are different reasons why healthcare precautions will wear this, what they call personal protective equipment, PPE, if you will. And, so it goes both ways. Yeah. It's all about stopping and prevention. But if a healthcare worker is taking care of someone and the patient doesn't have precautions, the healthcare worker really needs to explain themselves. Just a quick one-liner. Hey, there's nothing going on with you, but I'm not feeling well. And your patient's going to say, thank you. Just decency.
Mm-hmm.
Yeah.
And how is the airborne precaution different from droplet? Because some people.
Yes, that I put them on the same slide. They're transmitted similarly by sneezing, coughing, but the airborne precaution. So these started off as a droplet, but what happened is the moisture became evaporated. So you have these little nuclei that are just floating in the air. And, maybe like with droplets, like it's traveling in the air and then it does fall to the ground. But an airborne precaution, that these particles are so small that they stay suspended in the air for a period of time. And it finds a new host when the host comes along and inhales them. So how do you know that's going to happen? And that's a toughie. That's a toughie. Tuberculosis, the bacteria that causes it is Mycobacterium tuberculosis. These are very, very, very small bacteria, and they're suspended in the air, and they float in the air. And then when someone inhales these particles, they themselves become infected with TB. TB is the world's leading cause of bacterial death in the world. A lot of people across, like 3 million people every year. In the United States, not so much. We have taken the precautions for surveillance, if you will. So, if you're going to the doctor, maybe they'll take a chest x-ray, or they're going to take a blood test, quantiferon or a T-spot. That's a simple blood test. Should someone contract tuberculosis, there's a way of curing it, if you will. It's antibiotics for about 6 months, and they're really powerful. The symptoms would be like, unexplained weight loss, night sweats. Now, I respectfully say that they're not the same night sweats as menopause. They're very different. Okay, so that's speaking from knowledge. But, they're very, very different. If you're coughing up and the sputum is bloody or pink, that would be a red flag. And if you just have this cough, a lingering cough, and it's not going away, you need to call your doctor. And get evaluated. Another airborne precaution is COVID, the SARS coronavirus. These are very, very small particulate particles that are suspended in the air, and that's how they are transmitted. Measles is another one, and shingles. So the thing about shingles, so I'm hearing a lot more of it. It starts off as a rash, and then it might be a red rash, and what they call along the diatome of your body. And a diatome, the way your body is formulated are by your nerves. So everything is starting from your neck, from your spine, and the nerves are radiating out to your arms, your abdomen, and your legs. And so these little trails of nerves, if you will, are called diatomes. Well, shingles, that's where they land. And so you'll see a lot of times you'll see a linear structure along these diatomes, and then they turn blistery and they bubble up. And so the thing with shingles, and what makes it very, very unique, is that these bubbles are filled with virus. So if you touch it, then you could come in contact with shingles and become infected yourself. When these bubbles burst, these little viral particles are suspended in the air. And so if you inhale them, you could become infected with shingles. So shingles is really unique. So there's a contact precaution, right? We talked about in the previous slide. There's an airborne precaution if the shingles is all over the body. That's called disseminated shingles. Then you maybe put on airborne precautions, and that includes that mask from COVID-19, that N95. It's a very, very tight mask. People were finding it very difficult to breathe, but you just need to prevent those fine particles from getting into your airways.
Just a little bit of something about the N95. They need to be properly fitted.
Yes.
I know that sometimes people would say, "Oh, I got an N95," especially during COVID. That was like one of those like, "Oh, that's gold. You've got something really good there."
Yeah.
What a lot of people don't know is you need to be specially fitted in order for it to work.
To know that it is protecting you.
Yeah, at the hospital, we have to have a yearly N95 mask fitting.
Fit test.
Yeah, fit test.
Yeah.
And, they would, have us put on, they will look at our face, the shape of our face, the size of our body, and then, suggest, okay, try this particular size, because sometimes depending on the availability of the N95 from different distributors, we would have to switch to another company. So that means people need to get refitted. But it's like a yearly thing. We have to be on top of that. And so once you put on a suggested size of the N95, they tell you have to make sure it's properly fitted. And then they put this plastic thing over you.
A hood.
A hood.
Yeah, a hood.
Spray something kind of sweet in that hood. And then you're asked to kind of recite this particular poem so that you're saying something, you're breathing, you're exhaling, and then they ask you after you recite the poem, were you able to taste anything? And if you could not taste anything, that means the mask did its job.
Yes, 100%. We do that here too. Yeah. Yes.
So it's just, I don't want people to kind of think, oh, N95, that's a good mask. It is. But it's good only if it fits you correctly.
Properly. Yes. Good point. Absolutely.
You as a, infectious disease nurse, there's different masks are used for different airborne precaution, right? Type infection. Like, would you use an N95 for TB?
Yes.
You would?
Yes. Airborne and N95 go together.
Okay.
Would I use an airborne N95 mask for someone who has C. diff? I mean, those spores can travel in the air. It's not necessary. Maybe a surgical mask. And a droplet precaution, do I need an N95 that's a very tight fitting mask? No, but if I have a surgical mask, that is the barrier to stop those droplets from getting into my mucous membranes. So you bring up a very, very good point. There are different masks. And they're used differently for different purposes. Absolutely. A vector. What is a vector? A vector is anything that bites. Anything that bites. So this could be bed bugs, scabies, malaria, like from mosquitoes, a Zika virus. Anything that bites, you're put on what they call a vector precaution. Primarily, it's going to look very similar to contact precaution. Whoever's taking care of you, wearing gowns, gloves, maybe a mask. But this is how they're going to protect you. But a vector precaution is anything that bites. Funny, it doesn't taste like germs. And sadly, this is because this poor kid did not wash his hands before he ate. And what do we have? Well, now we have food poisoning. And that is most unfortunate for this person. So a common vehicle precaution is related to contaminated food or water. Okay, so contaminated water, we're boiling it. A common vehicle precaution for food poisoning or hepatitis A or salmonella. I want to talk about common vehicle precautions. And the number one thing about contaminated food or water is prevention. So if you know your water is spoiled or not good, either don't drink it or boil it. And you gotta boil water for at least 15 minutes, and that's gonna kill whatever microbe is in there. It's gotta be a rolling boil, okay? Food, you need to heat up this food. It needs to be heated up to an internal temperature of 165 degrees, and that is just absolutely imperative to prevent food poisoning.
That must be very common during the summer, the common vehicle precaution, people getting food sick from cookouts and outdoor.
Cookouts, it's that time of year.
Yeah.
So the FDA is saying that our food supply in the United States is very safe. And I believe that. I really do. I really, really do. However, there are going to be times when there's an outbreak, and these illnesses are known as food poisoning. And the federal government estimates 48 million cases. These are people who have gone to the emergency room, gone to the emergency department because they've eaten spoiled food. And that is the equivalent of 1 in 6 Americans. 1 in 6. That's high. They also estimate that 128,000 people are going to be hospitalized, and of those people, 3,000 people die every year of a foodborne illness. That was an astonishing statistic for me. But think of it, like I think anyone in their life can think of people that they have known themselves who have been hospitalized. And so now you think about, who are these people that have passed? It's always our vulnerable people, okay? And not necessarily our seniors, okay? It could be a young kid who has different, what they call comorbidities, have different illnesses. Everybody has their own thing that they have to deal with. And it just makes people more and more vulnerable to, or susceptible to, an unfortunate demise, if you will, from a hospitalization.
This is sort of off topic, but not really, because, there's so many homeless out there, and, walking around, or sometimes I drive and I would see people looking into trash barrels, hoping to find somebody's leftovers. And I wonder, okay, did they find food? And if they did, that's good, but how good is that food? Do they build up a tolerance in eating food that they find in the trash? They probably do, right?
I don't know. I mean, we live in for some people just live in the most desperate situations, and our human bodies are set up for protection, And it's just amazing to me, right? So if you've ever had a situation where you've had an acid stomach, well, really the acid in your stomach the pH is so low, and it's set up that way to kill any microbe or pathogen that you have unfortunately or inadvertently ingested. So it's fascinating. It's fascinating.
It does fascinate me because, I'm Filipina. And so a long time ago, when I was born there, came here when I was much younger. But when I go back to the Philippines, I can't tolerate the tap water.
Interesting.
Not because so I would have to make sure it's boiled, or coming from a well. And I stay away from ice too.
That is interesting. Yeah, I've heard other people, a friend from Vietnam and a friend from China, and they're like, no, we don't eat ice. We don't drink cold water. It's always and you would think the environment is so hot and humid that you would want something cold, but it's not like that.
Yeah.
Interesting. So the symptoms of a foodborne illness, they usually occurs 12 to 72 hours after eating contaminated food. However, it could take only 30 minutes, or it could be up to 4 weeks. And nausea, vomiting, diarrhea, that sort of thing, fever, body aches, headaches. These are some of your symptoms. But if you think that you've ingested spoiled food or that you're dealing with a foodborne illness, the key is call your physician immediately. You need to get that immediate intervention from your provider.
It is key, yeah. Because what can happen to these people, especially you mentioned the vulnerable groups, if they're not eating, not drinking, right? And they can't keep anything down, that's going to lead to dehydration.
Dehydration, that's also a killer. Dehydration, I'm telling you, it's so important for your health. You need to drink your fluids. My own grandmother, nope, I don't like the taste of water. And I'm like, oh, naughty, but you're looking at another UTI. Please drink your water. You put a little lemon in it or flavor it up a little bit, or tea, tea and coffee. So, okay, yeah, it's a fluid, but guess what? It's also a dehydrator. Mm-hmm. So you really need something that is going to hydrate your cells.
Yeah. Yeah.
So then a friend of mine, she says, well, I'm on that fluid pill and I'm in the bathroom all the time. And I get that. She's peeing. I get that. But the fluid pill is designed to protect your heart, and your cells in your body need that fluid replenished. And if they're not replenished, you're going to end up with an illness.
Mm-hmm. That's so true. Yeah.
Simple as that.
So it's a fine balance, especially for people who are on fluid pills. Definitely.
Absolutely. Yeah. I don't, my heart goes out to you. Seriously. I know, it's awful. Here we have some preventative situations here, 4 steps for food safety. So the first one is clean. So if you hit enter, wash your hands. Wash your hands before you gather your materials, whatever you're cooking. While you're cooking, just put things down, go over, wash your hands. Just wash your hands. Just wash your hands. And then we can hit enter again. And we're going to use one cutting board, okay? So let's use one cutting board for the meats. We're going to use another one to cut the breads. We're going to put that over there. We're going to use another cutting board to cut our vegetables. Different cutting boards for different functions, but don't intertwine them. Once we're cutting the bread on the meat cutting board, we've contaminated the bread. You know what I mean? So keep these cutting boards separate and keep them separate until they are cooked. So let's hit enter again. We want to make sure that we are cognitive and that we have actually checked expiration dates of our foods. Okay, so how about keeping a pen and a magnifying glass near your refrigerator? Can you pick that up really quick and look at your expiration date? I can't tell. I've looked at expiration dates and said, oh, really? That's expired? And I was shocked. I just don't chance it. Maybe because of the line of work that I'm in. I don't want to chance eating spoiled food. And then again, have a thermometer, or that internal temperature of your foods needs to reach 165 degrees Fahrenheit to ensure that any pathogen that is in or on that food is dead. It has been neutralized. Then it's safe to ingest. And then if we hit enter again, when we talked a little bit about this summer, and we're coming up to the cookouts and we're coming up to family outdoor gatherings, Listen, after 2 hours, that food has to go, it has to be taken away and put back in the refrigerator. But if we're dealing with a day that's 90 degrees, 100 degrees, please do not leave those foods out for more than an hour. And that's even if these foods are on ice. Do not leave them out. Any perishable foods for a cookout, when you're serving it, you need to make sure that these foods are on ice. Your cold foods are cold and your hot foods are hot. And then after 2 hours, pack it up. But if it's over 90 degrees, even if it's 100, and you're at this cookout, you're going to be in shaded area, okay, but no, it needs to be packed up after an hour. That is going to keep your foods safe, your leftovers safe. You want to look at the temperatures in your refrigerator, in your freezer. So your refrigerator temperature should be 40 degrees or below. Your refrigerator, okay? When you open it up, make sure, or get a refrigerator thermometer if you don't have one, if there's not one built in. And your freezer must be at 0 or below. And that is going to help keep your food safe. Now, that being said, again, you want to look at expiration dates. Safety for frozen foods, that's a big deal. You know, if you've bought something at the supermarket and you put it in the refrigerator, but now it's been, 6 months and you want to eat that steak, you probably don't want to do that. And I don't know exactly. I can research that and bring it up another time, but there are certain time frames for these certain things, meats should only be like no more than 2 months or something like that, or no more than 3 months. And then you got to get rid of them. We've got freezer burn. And then there are microbes that enjoy very, very cold temperatures. So we got to be careful of that. There are microbes that enjoy very, very hot temperatures. All right. So, out at Yellowstone National Park, right, there are these waterways and they're different colors and, oh, isn't this special and everything, or they're hot springs or something like that, and they're different colors. Well, those are different bacterias. The bacteria can live in any such a wide variety of temperatures. But coming back here to our foods, keep your food safe, keep yourself safe. With the expiration dates, read them, understand them. Perishable foods at a cookout, be mindful that don't leave them out too long and pack them up.
What's one or two things that you want people to come away with, so that you know that you have delivered the message that you really wanted to deliver today?
Cover your mouth. Wash your hands. If people are just doing that, I would be thrilled, because I believe that these are the two most important ways of preventing communicable diseases. Yeah, it's kind of like saying please and thank you. It's that basic. But I'm out shopping or something like that, and you hear it all the time. People are just in these halls or in the aisles of the supermarket, and that they just sneezed and they didn't cover their mouth. Oh my God! Not only is it disgusting, but it's not safe. It's just not safe. And just wash your hands. Wash your hands. Your environment, these high contact touch areas, the countertops, the sinks, just like you said, the faucets, the toilet sinks, the light switches. We don't think about these things really often, and it's so important. It's so important.
Very, very important. I'm so glad you came on today to really talk to us about, prevention. Keeping everybody as healthy as possible.
Thank you so much. I enjoyed this program. You're doing such a great service for the people you serve. I totally believe that.
Thank you
Yep.
so much. I can't wait to have you back on again. So, Mary Jo McCluskey, thank you so much for being on the program. And
Thank you.
also, I want to thank the Quincy Health Department for continuing to sponsor Aging Strong. Until next time, everybody, stay safe, be well.